Welcome back to What's Now. Right now we are going to focus on women's health. Many women have been putting off routine examinations with their doctor due to the pandemic. This is not a good thing to do. There's also many subjects that we don't talk about with women's health. Here's more.
For many women, 2020 was not a year to tackle lingering or even taboo health issues. But as we approach 2021, many women are looking to prioritize their full body wellness and address issues that went unaddressed. Joining us today to help us get on track in the new year is nationally renowned celebrity OB-GYN, Dr. Suzanne Gilberg-Lenz. Thanks for being here.
Thanks for having me.
So, doctor, what are the most common female health issues that we don't hear as much about?
Well, I think probably the most common female health issue that we don't want to talk about is incontinence, urinary incontinence. More than half of us have an issue with it at some point during our lives, and less than half of us are willing to talk about it. So I partnered with Tenna, a wonderful company that makes incontinence treatment products, specifically pads. They have a new line of intimates. And we did a survey over the summer, which really just confirmed data that we already had in the medical literature. More than 70% of women are not even discussing this with their provider. So we have a serious problem that's not just a quality of life issue, but can cause health problems that's not being addressed. And that's what we want to do. We want to educate. We want people to know that there are products out there that are safe and that are designed specifically for this issue. And I think where people feel stressed and burdened and also embarrassed and ashamed, this is now literally a click away. Just go to tenna.us. You can find all this information. You can educate yourself and you can find products that are really healthy. We want to protect that skin. You know, we're sitting in our Zoom calls and our yoga pants all day, not moving, drinking coffee, and we need to have the right products, not period products, incontinence products. They are breathable. They wick the urine away from the skin. That decreases damage to that fragile area, decreases infections, and now you can kind of go about your business. Really, really simple.
And Dr. Suzanne, what are some simple self-care practices that can improve our everyday lives?
You know, it's really basic stuff. I don't want people to feel more stressed and burdened than they already do. And I feel like self-care ends up on that to-do list and it's like a pressure. Basic stuff. Drink your water. Eat good food. This time of year, you know, we're indulging. Okay, that's fine. Have fun. But reaching for the baked goods and the alcohol as a coping mechanism is really no joke. I mean, we want to talk about substance use and replacing those habits. Moving around, even if it's cold out, move around your living room. If you've got kids and other people at home, bring them into that equation. Making sure you're protecting your time and space, having boundaries, saying no. It's really important for you and it's important for them. You're modeling that behavior. And sleep. Put the device away. Give yourself some time and space to sleep. If you want to have better mental health and a better immune system, you've got to do all of these things. And they're super easy. They're basic. It's just like survival stuff, you know?
Oh, it really is, but such a good reminder. And recently, celebrities like Chrissy Teigen and Ashley Graham have spoken out about incontinence and pregnancy. So what tips do you have for expectant and new moms?
I mean, first of all, I really want to thank them for being open about just normal bodily functions. It opens the door to a conversation and normalizing our bodies. And I think in a year where our bodies have been so much on focus in terms of illness and the pandemic and immune system, having this beautiful experience of pregnancy is still really going to be joyful and magical. And I want to remind women that it's still a special time. Maybe it's not going to be your fantasy that you had and, you know, a huge reveal party and a big shower and everybody at your birth, but that doesn't mean that it can't be really perfect and special and wonderful. And it's bringing so much joy and hope to everybody, to the rest of us. I want people to focus on the basics. I mean, what's really important here? Our health. So having gratitude and appreciation for our bodies. And, you know, I want to thank these pregnant women because I'm getting the experience of having something really happy and positive happening. You know, they're bringing us hope for a new transition, a new life, a new world. Remember, that's what's important.
And how has telemedicine changed the field of medicine throughout this pandemic?
Oh, it's been revolutionary. Having access to our patients and our patients having access to us across state lines for now is actually legal. So you have access to doctors you maybe wouldn't have been able to see before. We can make sure that we're checking in on you, that you're not ignoring your health in a time where it's either difficult, scary, or impossible to get out of the house. I mean, these are just game changers, and they're not going to go away. They're really going to improve the quality of people's health for people who have access to it.
They really are. Where can we get more information about everything you've talked about today?
Well, you can get really important information on these women's health topics and on the products at tena.us, tena.us. And that's a really important start, just to educate yourself.
Well, thank you so much, Dr. Suzanne, for joining us today here on Park City Television with this important information about women and wellness.
Thanks.
Thanks for watching this episode of What's Now, all about your health. Be sure to tune in to Park City Television all day, every day. You can find out more about our programming at parkcity.tv. And our live show is every day at 8 a.m. Mountain Connections. You don't want to miss that. Thanks for joining us. We'll see you next time.